Okay, so I'm gonna be at my cart. Hand hygiene, unlock. Okay, what do we have? Gentamicin, 60 mg, IM stat for Fletcher Bishops. Okay, so let's find my medication. Gentamicin 60, 40 mg per ml. So 60, 40 mg by 1 ml equals 1.5 mLs. And that makes sense? Okay, perfect. So gentamicin 60, 40. Get my supplies. Since I'm doing 1.5 ml, 3 cc's, that's perfect. And I'll need a 25 gauge. Okay, so clean off my bottle and check my drug guide. All right, gentamicin for infection, 1 to 2 milligrams per kilogram. Okay, and that makes sense for the weight of my patient. And make sure they hydrate and check vital signs, input and output. Perfect. So, get it ready. Okay, back down. All right. Perfect. And 1.5 ml of air. Okay, the air in here. Flip it over and take out 1.5 ml of my liquid. Okay, 1.5 ml of my liquid. Without any of my bubbles. Okay, scoop the cap on. All right, so gentamicin 60 over 40 times 1, 1.5, 1.5. Okay, put my medication back, lock my cart up, and there's nothing on top of my med cart, and back to the patient's room. All right, knock, knock. Hi, provide privacy. My name's Kelly. I'm going to be your nurse today, so I have an injection for you. Can you tell me your name and date of birth, please? Okay, perfect. And then do you have any allergies? No known allergies? Okay, I'm going to look at your armband. Yeah, no known allergies. Okay, perfect. So I'm going to raise the bed up a little bit to my working height, and I'm going to have you flip over to your side because we are going to need to put this in your dorsal gluteal area. My landmarks for that are going to be the posterior superior iliac spine and the greater trochanter of the femur. And so we're going to do your vital signs quick before we do your injection. Make sure they're still within the normal range as we are monitoring those with this injection. And you've been drinking lots of fluid. Perfect. So we're going to have you continually drinking your fluid. All right, so I'm going to have you roll over to the side. All right. Okay, so clean the area. once it's air dried, cap off, throw that away. I'm gonna Z-track, put a 90-degree angle. I'm gonna aspirate, make sure that we got no blood. Perfect. And 13, 14, 15. Okay. Put my cap on till I hear the clip. Then I'm gonna put it in my shards container. Okay. So, do you have any questions before I leave you? No? Okay. Put you back, cover you up. Your call light's right here. We're gonna put your bed down to a low position. I'm gonna make sure the room is free of clutter. And remember to keep hydrating. I'm gonna come back in about half an hour to check your vital signs, make sure they're still within the regular amount. And then the next dosage, we're gonna have to put it in a different site because we do need to switch around sites for this medication. So, any more questions? No? Okay, perfect. Well, I will see you in about a half hour. Again, my name is Kelly, and I'm going to be your nurse today until 2 o'clock. Okay? All right, sounds good. And then I'm going to document the date, time, site, and my initials.